to talk about a disorder we see a lot here, panic disorder. What is that?
Panic disorder is a type of anxiety where you have racing thoughts, you have chills, you're sweating, you're nervous, you're pacing, you're irritable, can't sleep, can't eat. Generally speaking, those are a lot of the characteristics of a panic disorder.
So panic attacks are a symptom of a panic disorder, or they can be?
Yeah, they can be. Panic attacks are they're short-lived. They're very specific. Panic disorder is something that is ongoing. It could it could be on a daily basis. It could be every day you're having some type of panic response to something.
And how does that manifest in somebody's life?
So it manifests in anything and anywhere. It can come out of nowhere. It can be from stress, which is a big deal. It can come from getting good news or bad news. It can come from work-related pressure, relationship issues. It really can come from anywhere.
How do you go about treating it?
The good news is that it's actually very treatable. Cognitive behavioral therapy is the best way to treat a panic disorder because you want to tackle someone's irrational beliefs and you want to give them coping skills. To me, with this disorder specifically, breathing techniques, a lot of the stuff that I know you like to do is phenomenal with panic disorders because remember, it's a stress on your system, and if you can get your breathing under control, as simple as that sounds, right? Yeah. I'm not even talking about medication yet, but as simple as that sounds, you can reduce it significantly. So breathing techniques, yoga,
there's sort of this feedback loop, right, where the body gets impacted and then the mind as a result of that starts running, and so one feeds the other.
Yeah, and let me just say this because I know that you'll appreciate it. Medication does help panic disorder, but it's also someone who suffers from this, they're susceptible to addiction because when you have a panic disorder and you're constantly your system is constantly at a high end, a lot of, it's like a pressure cooker. You take some Xanax, you get relief. You're going to want to keep getting that, and it's instant.
Well, there's a fight or flight aspect, mainly a flight, right? Like that comes and you just want to get out of it. And we, often know what takes that away.
Right.
But obviously that can compound the issue big time.
Right. So, it's another factor, to consider, but very treatable. Many of our patients do have panic disorders, and I'll tell you, unfortunately, mothers of our family members have panic disorders. They suffer from it more than the husbands. They have other issues.
Sure. Great. Thank you.
You're welcome.